This cow is giving birth. I'm a dairy cow veterinarian, and I'm here to take you through this whole process. So let's watch it together, uncut. Right now, this cow is laying down. She is in active labor, meaning she's having abdominal contractions, and the baby is coming out. This whole process, from active labor to when the baby is actually coming out, for a mature dairy cow, takes about 1 to 2 hours. But it's going to happen in the next 10 minutes. This cow is in a group pen. You can see the other cows behind her. So I work at this dairy farm and I go and check on the cows' pregnancies. And when I check on them the first time, I am able to give them an accurate due date. So the farmer knew exactly when this cow was due to give birth, and he moved her into this pen specifically because all of these cows are due to give birth within the next 2 weeks. This is called a close-up pen because they are all close up to giving birth. There's also a far-off pen, a pen of cows that are far away from giving birth. The nice thing about having a lot of cows is you can organize them by their due date or by their life stage or by their cycle so that we can make sure that they're getting exactly what they need. So, for example, the cows in their last 3 weeks of pregnancy get a special diet to make sure that they're ready from that transition to start producing milk. Right now, this cow is a dry cow, meaning her body is preparing to give milk, but she's not being milked every day. As soon as she gives birth, that's when the lactation starts. So we will start milking her at that time. You can see here she's pushing pretty hard. Notice really closely what's coming out. That little white spot is the calf's foot. And then the foot is in a sac. That's the amniotic sac. When I looked closer, I could see a second foot as well. It's really important that we see 2 feet coming out of the cow, and they should be front feet for that calf to be presenting normally. And then once we see those front feet, as she keeps pushing, we should then quickly see the nose, because the calf should be born in a diving position. If one foot is back or the head is back, she's not going to fit out and she needs assistance. Most cows can give birth without assistance, but some of them do need assistance. Now let's look at her udder. Do you see that dripping out? It's thick looking, yellowish looking milk. That's the colostrum, the first milk that the cow makes. That first milk is way richer than regular milk, and it also has a lot of antibodies in it that are really important for the calf. So that first milk should always go to the calf. Calves are born with 0 immunity, a naive immune system, meaning they have no protection against the world around them. That's different from many other animals, where antibodies can pass through the placenta from the mom to the baby. In cows, that doesn't happen. So the only way for that calf to get some immunity, some protection, is by drinking the colostrum from the cow. So that colostrum is hugely important for the success of the calf. And this cow's body knows that the calf is coming and that colostrum is starting to come out. This cow is in a pen that has dirt bedding. So you can see it's pretty built up and she has a soft place to lay down. But yes, it is dirt. She is not on grass because the grass does not grow very well here. The grass out here is very pokey and dry. You also can't clean grass out very well or make it softer. The nice thing about this type of bedding is you can clean it out every day and then add new bedding to make sure that she has a comfortable place to lay down. Some farms will have straw bedding, some farms will have pasture, some farms will have dirt. There's different types of bedding that you can use for cows, but what's most important is that it is clean and dry. Here you can see that there are 2 feet coming out. Can you see that? One is closer to us and the other one's a little farther away, but they have little white hooves that you can see inside that amniotic sac. The amniotic sac is covered in flies, and I usually get a lot of people commenting on that. These cows live outdoors, so there are going to be flies. Most dairy farms will use some sort of pest and parasite mitigation that's actually required for most animal welfare evaluations and audits, but we can't eliminate the flies altogether. Okay, so here we start to see the head coming out. Just past the feet, you can see the head. That is telling us that the calf is in the correct position. Again, we are always looking for signs that we need to intervene, but most cows will calve on their own, and it's not good to intervene too early. So I also hear a lot of people say, why don't you help her? This cow needs help. It's been too long, and they're concerned about the calf. But this is a normal process. Remember, in humans, the baby comes head first, but in calves, they come feet first in that diving position. So if you think about it, their feet are coming way before their body. So their legs are really long. So just because we can see the feet doesn't mean that calf is in distress at all. Right now, the feet are out, the legs and the head are in that birth canal there, but the body is still in the uterus. We are not moving that calf out, and we shouldn't be moving that calf out too quickly. If I went up and just pulled on that calf really, really hard, I could actually cause a lot of damage to the calf or to the cow as well. We could cause tears and excessive bruising, and that's just really not necessary. Part of dilation of the cervix is that pressure. So the cow needs to push and feel that pressure in order to fully dilate. She's probably not even fully dilated right now. That happens during the birthing process. And just like many mammals are in labor for hours and hours, and we don't just grab and pull, this is normal for the cow. We are following this labor and delivery and making sure that she is birthing this calf properly and that there's no signs of distress. Now, if there was signs of distress, let's say the cow was seeming too uncomfortable, or we're not seeing the head and the feet, or we're not seeing things proceed in a normal, timely fashion, she's not making progress, or there was a lot of blood, well, then we would intervene. And there are ways that we can check her dilation, we can give her some medication, and we can intervene. But if we don't have to, we let nature take over, because this is a natural process, giving birth. All right, so look closely up at the top here. You can see that little pink part is the calf's nose, and then you've got some white and black. That's the calf's head. So see, if you look closely on the top, like closest to the cow's tail, is the calf's head, and then just below that are the calf's 2 feet. And this calf, when it's born, is going to be around 80 to 90 pounds. So it's a pretty big calf, and it's going to be really long. So we're seeing the head here, and then after that comes the body, and then the back legs will be outstretched as well. So she still has a ways to go, but it's all going to happen pretty quickly here in the next 5 minutes. If we were to intervene, it becomes challenging to do that while she's laying down in her pen. So we would have to stand her up and walk her over to the chute and clean her up, and it often will slow down the birthing process. So we don't do that unless we have to. All right, here, once the head comes out, the rest usually comes pretty quickly. There's a few spots that they can get stuck, like at the shoulders or the hips, but this one's coming out pretty normally. And the whole thing comes out right here. This calf has that amniotic sac over its nose, which I don't like. So I went up and I removed that so that it can breathe. And you can see it's blinking its eyes and it's starting to move around and take its first breaths. There's some bleeding here. That's normal. A little bit of bleeding is normal, but there's not excessive bleeding. I always make sure that I'm watching for any excessive bleeding to make sure that she doesn't have any tears. We also will bring her up to the chute to do a full exam on her, and we'll do a full exam on the calf to make sure that they're both in good condition in order to give them anything that they need, some pain medication or some stimulation or whatever they might need. We make sure to give it to them. All calves need their colostrum, and it's important that they get the right amount of very clean, high-quality colostrum within the first hour of their life. Many people recommend within the first 6 hours. There's actually a lot of really interesting data about how well they absorb that colostrum. They absorb it the best within the first hour. It drops off a little bit by 2 hours. By 6 hours, it's dropped off quite a bit, but they're still receiving enough to get that immunity. By 12 hours, they're essentially absorbing almost very little of it, and by 24 hours their gut is fully closed and they will not absorb the antibodies from that colostrum anymore. I didn't have great service here, so sorry for the cutting in and out, but this calf is doing just fine. It's looking around. Look, its back leg is still inside. It needs to start moving in order to get up. There you go. Calves are usually up and walking around within the first 1 or 2 hours is what we typically say. But Holsteins, I see that more delayed, maybe around 4 to 6 hours of life when they will voluntarily get up and walk around. But with some assistance, they usually do pretty well within the first few hours. The cow is still recovering, and because a lot of the calves have troubles getting up and getting to the udder, and the cows don't always accept them, and it's so important for them to get their colostrum right away, we will typically milk the cow and get that colostrum and then bottle feed the calf. That's really common on dairy farms in the United States. It's not 100% of them do that. Some of them will allow the calves to nurse on their own, but there's a lot of problems associated with that, and so making sure that they get their colostrum is really important. Now, this farm uses sexed semen. That means the cows are bred with semen that is predetermined to have females. So there is a 99% chance that this calf is a female, and I can actually diagnose that on ultrasound too as a part of their regular checkups. Because this is a female calf, she will be raised on the farm, and she will join the herd, the milking herd, when she is about 2 years old. And she will join this cow, her mom, when she's about 2 years old, and they will be kept on the same farm together. There are a lot of cows on this farm, and it's interesting because the cows know each other. They learn their social groups, and they establish a social hierarchy, and they know who's in their group with them. On many farms, we wait for the cow to get up and start licking her calf to clean it off and then also to stimulate it. And that will also stimulate her to pass her placenta. But this cow doesn't seem very interested in doing that. The placenta needs to be passed within the first 12 hours is normal. And if it doesn't get passed, then it's considered a retained placenta. And that is a real source of infection and can cause an infection in the uterus. And it's important that it gets taken care of right away. There are a lot of things that I do as a veterinarian on dairy farms, and I love my job. And maternity is just one part of that. If you guys want to learn more about where your milk comes from, how cows are managed on farms, or anything else, let me know. Do me a favor and hit subscribe and drop a note in the comments. Thanks, you guys.